Pharmacists, the unsung heroes of diabetes management, wield their expertise to transform lives. Get ready to witness the transformative impact they have on diabetes management, guiding you towards a healthier and brighter future. The roles of pharmacists in diabetes management. Medication management. Conducting medication reconciliation and identifying potential drug interactions between medications. For instance, checking for interactions between metformin and cimetidine, which can increase the risk of lactic acidosis. Educating patients about the use of injectable GLP-1 receptor agonists, such as dulaglutide, Trulicity, or liraglutide, Victoza, and their proper administration. Diabetes education. Offering comprehensive diabetes education, including the management of complications. For instance, discussing the importance of regular eye examinations for diabetic retinopathy and recommending visits to ophthalmologists. Providing education on the benefits of continuous glucose monitoring, CGM, systems, like Dexcom or Freestyle Libre, for improved glucose control and trend monitoring. Blood glucose monitoring. Demonstrating the proper use of blood glucose meters, such as AccuCheck or OneTouch, and ensuring accurate readings. Educating patients on how to interpret blood glucose patterns and adjust their medication regimen accordingly. Lifestyle counseling. Advising patients on carbohydrate counting and portion control when using rapid-acting insulin analogs like insulin aspart, Novolog, or insulin Lispro, Humalog. Encouraging the adoption of regular physical activity and the use of activity trackers, like Fitbit or Garmin, to monitor exercise levels and set activity goals. Medication adherence support. Collaborating with prescribers to simplify medication regimens, such as combining multiple daily injections into one using insulin degludec, liraglutide, Zoltafi. Recommending insulin pen devices, such as NovoPen Echo or Sanofi Solo Star, to improve medication adherence and ease of use. Hypoglycemia and hyperglycemia management. Educating patients on the prompt treatment of hypoglycemia using glucose gel, e.g., Instaglucose, or glucose tablets, e.g., Dextro Energy. Discussing the management of hyperglycemia with short-acting insulin analogs like insulin Lispro, Humalog, during acute illness or before meals. Ketones and sick day management. Recommending ketone testing strips like Ketosticks for patients with type 1 diabetes to monitor ketone levels during illness or stress. Providing guidance on when to seek medical attention for ketone levels above a certain threshold while using sodium glucose cotransporter 2 inhibitors, SGLT2 inhibitors, like empagliflozin, Jardiance. Drug allergy and adverse drug reaction management. Identifying allergies to sulfonylureas like glimepiride, Amaryl, and recommending alternative anti-diabetic medications. Discussing the potential for skin reactions, such as rash or itching, with the use of dipeptide L-peptidase 4 inhibitors, DPP4 inhibitors, like sitagliptin, Januvia, and advising patients to report such reactions to their healthcare provider. Diabetes technology support. Assisting patients in using insulin pumps, such as Medtronic MiniMed or Tandem T, Slim, and providing guidance on setting basal rates and bolus calculations. Smoking cessation counseling. Offering counseling and recommending nicotine replacement therapy to help diabetic patients quit smoking, as smoking exacerbates diabetes complications. Travel health counseling. Advising patients on how to manage diabetes while traveling, including considerations for time zone changes and access to medications. Telehealth consultations. Providing remote consultations for diabetes management, including medication adjustments and lifestyle recommendations through telemedicine platforms. Polypharmacy review. Conducting comprehensive medication reviews to identify unnecessary medications and optimize drug therapy, especially in elderly patients with multiple comorbidities. Support for insulin titration. Collaborating with patients to adjust insulin dosages based on self-monitored blood glucose levels and reviewing the results regularly to achieve glycemic control. Gestational diabetes support. Providing specialized counseling and education for pregnant women with gestational diabetes, including dietary adjustments and self-monitoring guidelines. Home health visits. conducting home visits to assess patients' living conditions, storage of medications, and accessibility of diabetes supplies for enhanced self-management. Mental health support. Recognizing the impact of mental health on diabetes management and referring patients to appropriate resources for stress management and emotional well-being. Community outreach programs. Organizing community diabetes awareness events, health fairs, or support groups to promote diabetes education and prevention in the local community. Thank you for joining us today as we explored the diverse roles of pharmacists in diabetes management. Remember, our team is here to support you on your journey to better health and a brighter future.